Do you often notice your child getting the same skin bumps or lung infections over and over? Or maybe their skin keeps cracking and oozing, no matter how much cream you apply. These could be signs that something deeper is going on with the immune system. Hyper-IgE syndrome, also called Job syndrome, is a rare disease where the body's defense system, immune system, doesn't work properly. Because of this, people with this condition face frequent skin and lung infections, unusual facial features, and very high levels of a certain antibody called IgE. Think of IgE like an alarm molecule. In this illness, the alarm keeps ringing, even when there's no real danger. Let's find out why this happens and what can be done. So what causes Job syndrome? Imagine your body's immune system is like a team of superheroes. Each superhero has a special job. Some fight bacteria, others fix mistakes. In Job syndrome, one of these superheroes has a broken instruction manual, meaning the genes, like body's blueprint, that tell the immune cells what to do are faulty. Most often it's mutations in a gene called ST, a T3, or DOCK8. These genes normally help immune cells communicate and direct attacks on germs. But when they're broken, your body can't clear infections properly and overreacts by making too much IgE. It's like calling 10 fire trucks for a campfire. And yes, this condition can be passed from parents to kids, even if the parents don't show signs. So if two people in your family have severe allergies and infections, it might not be just bad luck. It could be linked to genes. Let's play detective for a moment. What clues would tell you someone might have Job syndrome? First, colds that turn into lung abscesses again and again, like one child who keeps getting pneumonia after pneumonia, even after antibiotics. Second, skin. Have you seen pimples that act like deep sores and leave tracks under the skin? These are called cold abscesses. They're not hot or red like normal ones. Third, allergies. Extreme eczema that doesn't improve with creams. And oddly, many people with Job syndrome have distinctive faces, broad nose, deep-set eyes, and they keep their baby teeth way too long, even as adults. Bones might break easily too. So if someone says, "I've had 10 skin infections in a year and my teeth still haven't changed," it's time to look deeper than just hygiene. It's a sign the immune system needs help. First, they will ask, how often do you get sick, any family history? Then they will run blood tests, especially checking IgE levels. If yours is 10 times higher than normal, boom, that's a red flag. But it's not enough. They will also look at your genes through DNA tests to find faults in ST, a T3, or DOCK8. Think of it like checking the code inside a robot to see why it's acting weird. For treatment, there's no magic cure yet. But doctors use antibiotics regularly, like giving a daily shield against germs. For eczema and allergies, creams and antihistamines help, like putting out small fires before they spread. In severe DOCK8 cases, a bone marrow transplant might be an option. It's like replacing the broken immune team with a new one. And importantly, early diagnosis means better control, catching problems before they damage lungs or skin for life. Can we stop Job syndrome before it starts? Unfortunately, since it's caused by gene changes from birth, we can't prevent it like a cold. But here's the good part: we can prevent the damage it causes. Think of it like living in a storm-prone area. You can't stop the storm, but you can build stronger houses. For families with a history, genetic counseling is key. Doctors can test parents and unborn babies to see if they carry faulty genes. Parents can then make informed choices. Once a child is diagnosed, preventing infections becomes the goal. Regular checkups, flu shots, avoiding crowds when sick, and using antibiotics before problems grow. Simple habits like hand washing and clean living spaces can save lives. So while we can't prevent the genes, we can prevent the disaster they might cause. What's new in the world of Job syndrome? Scientists aren't giving up. Right now, researchers are testing gene therapy. Imagine fixing the broken instruction manual in immune cells by inserting the correct gene. Early studies in labs show promise especially for DOC8 patients. Also, new drugs are being tested that calm down the overactive IgE response, like putting a volume knob on the alarm system. One drug called dupilumab used for eczema is being tried in patients with Job syndrome and shows improvement in skin and asthma symptoms. Another advance is better tracking hospitals. Now, use immune passports, personalized health plans for rare diseases. These help doctors act fast during emergencies. So while it's still rare and tough, the future is brighter, more understanding, more tools, and more hope for those living with this condition.